It would help, I think, people to understand common reactions to these kinds of things. And in the early phases, like the first month or two of exposure, people will experience things like just increased anxiety and fear. That's very typical. They may have sleep problems. They may feel aroused, like wound up all the time. They may, some of them may change their behavior. They may not be, exposing themselves to situations they perceive as similar, or for example, maybe coming to the city if they're from a rural area. They may not go to events like a rider game, this sort of thing. That is all very typical, and people should not feel like there's something, amazingly wrong with them, around that kind of period. And initially we recommend, or I recommend in my work, a watch and wait, a monitoring approach. If it's really bad, some short-term medication can help. That's a discussion I would encourage people to have with their medical practitioners. It's usually not something I'd like to see people do over the long term. More so just keep to your routines, get back to your life, use the support of friends and family members, and for most people these things get better with time.
Is there some advice you could offer when speaking to kids about it, when they catch some of what's happened or hear stories where the grown-ups talking about something and that they have questions about, why did someone do something like this? Why is there such evil in the world?
Right. I'm not a child clinician. I don't work with kids, but I can suggest what I would do. I think it's good to be proactive and have kind of an age-appropriate discussion with maybe your own children, or children in your life. And older kids will be able to work with these ideas and concepts a little more. But I would say things like, we don't understand why people sometimes do very bad things. They do happen, but for the most part, the world at least our world is a safe place. The world that we have here in Canada, and it's not necessarily so everywhere. But there are many people who are caring and supportive, and keeping these conversations going, I think, are important with kids. I don't think it's good to avoid talking about it with children. Avoiding the topic, avoidance, in my view, of these discussions and situations and so on is counterproductive and can contribute to a worsening picture.
How does social media contribute to how we respond to this? Do you have some thoughts about that?
Oh boy. I mean, a related recommendation might be to monitor what kids are looking at, and even limiting their exposure. Like, nobody, in my view, I mean, before we started taping here, you and I were talking about how much of this you sort of let into your consciousness.
Yes.
I don't watch news, and it's not because I find it aversive or anything. It's just because we don't watch TV. Sure, I watch stuff on the internet, but social media probably has the potential, certainly, to exacerbate and ramp up the exposure to these things. So I think, to the extent that kids, young people who are using social media, can learn to self-limit their exposure. I have clients, some veterans who they tell me how they just they take Facebook holidays because they don't want to hear the things they're hearing from some of their colleagues on chat groups, or the things that people are posting, this kind of thing. So,
are there some resources out there for people who maybe don't have the money to come and see a psychologist or a counselor, but would be interested in learning more about how to deal with some of the feelings they're having that are not positive? Most
definitely. I have a go-to resource I recommend to clients now. It's Anxiety BC's webpage, and it's traumatic stress is a fear and anxiety related issue. It's the best go-to resource, in my view, for all things anxiety. And there's a section in there on post-traumatic stress, acute stress. There's even a self-help toolkit where you can learn some relaxation strategies. There's education on common reactions. These are all good places to start. And at the outset, I would encourage people to self-monitor, monitor family members, and do those things to care for one another. And as time goes along, these difficulties should abate. But if they don't, that's when it's time maybe to seek some help.